will be what is prophylactic mastectomy and what's the high-risk group who needs prophylactic mastectomy and what are the controversies. So I will start with a patient story. Is Wendy, is a fake name, 35 years old, who works in a bank. And as in India, we in Singapore do see a lot of patients below the age of 40 years with breast cancer. And she came to me with a newly diagnosed stage 2 breast cancer. And she had a very strong family history of breast cancer, and she's a mother of 2 kids, 10 and 4 years old. What should we do? We should just go for operation, or we should do something else. So there are 2 options. I can just go ahead with a breast cancer operation, or should I send her for genetic counseling? Finally, after discussion, she thankfully agreed for breast genetic counseling, and she went for that. 2 weeks later, she came back with the result, BRCA1 positive. So then we have to go for bilateral mastectomy to prevent a second cancer in the breast with sentinel lymph node biopsy and reconstruction. And that means she had a prophylactic contralateral mastectomy. So post-surgery, she recovered well, and she went for adjuvant treatment. So here comes the question, what is prophylactic mastectomy? Prophylactic mastectomy is the surgery to remove one or both breasts to reduce the risk of developing breast cancer. It can be either bilateral or can be a contralateral, depending on whether the patient already had cancer. And it is supposedly reduce the risk of developing breast cancer by 90% in patients with a high genetic risk. And it can be either total or a subcutaneous mastectomy. Subcutaneous mastectomy, otherwise known as a nipple-sparing mastectomy now, where we keep the nipple areola complex. But the problem is whether there's a chance of developing cancer under the nipple areola complex. It is there, but it's very, very low.